kind of funny. I just want to let you guys know I have 3 ring lights going. That's why I'm not wearing my glasses, because it is a huge distraction. Hi everyone, welcome back to my vlog. This one is going to be about having epilepsy and catching the stomach bug, because that is what I have right now. So I'm basically going to give you guys some tips that have helped me in the past, and then I'm also going to go on the Epilepsy Foundation and kind of read what tips they have on there, because that is where I get all of my information from. I don't get anything else, like any other information from any other organization. Epilepsy Foundation is where it's at. Also, to let you guys know, today is probably one of my better days. I've had the stomach flu for about 3 days. Today I'm actually able to sit up, kind of walk around the house without feeling like I'm gonna pass out or throw up all over again. I was scheduled to work today, but I don't think it's a good idea, so I'm just gonna do this quick video to give you guys some helpful tips. I have my laptop right here. I'm gonna type in Epilepsy Foundation. Epilepsy Foundation. Okay. And I'm gonna go over to the search bar, search engine, whatever, and I'm gonna type in the flu. See what pops up. Now there's multiple things that could go wrong with having the flu and being on certain medications. I did put a link in on my page yesterday, just to kind of help you guys if you needed any like information that, you know, if you do catch, whether it be the stomach bug or an upper respiratory flu, taking antibiotics while also being on epilepsy medication, they do interact. There are several different antibiotics out there that I am not able to take because of it. Cipro being one. I will put it in the video right now. Here is the website that I got this information from. I will also link it down in the description below. Okay, so I'm looking at the Epilepsy Foundation right now. It says the flu season. Do you need to worry about medication interactions? Yes, you do. As far back as I can remember, I've always had a really crappy immune system. Yeah, it was really hard for me to find the right antibiotics, even over-the-counter, like allergy medicine. Like, for the longest time when I was on Trileptal, I was on that for a very long time. That one, you really have to be careful with what antibiotics you take, because it can interact and it can potentially cause more seizures. I'll talk about when I was on Cipro. So I get bladder infections all the time. I actually went to my urgent care in my town for it, and the doctor there was really nice. This was, gosh, 5 or 6 years ago, maybe not that long ago, but it's been a while. She prescribed me Cipro, and she told me that I needed to take it, I think it was like 3 times a day. It might have been 2 times a day for like 10 days. I swear to God, the second day I was on Cipro, I had probably 3 seizures. It was bad. I saw my neurologist like the next day, I think, and he told me that one of the main side effects of taking Cipro is having seizures. Even if you don't have epilepsy, that was one of the main causes. I don't ever take Cipro. I'm sure it's different for everybody. I'm sure there are people out there that have epilepsy that can take Cipro without having any problems. But for me, that one just, it doesn't work. My mom, she has a condition that she gets when she eats nuts, like peanuts or anything like that, buns with, seeds in them. It's called diverticulitis. I will put a description of what that is right now.
I am so sorry that it's kind of blurry, so I'm going to read it for you. An inflammation or infection in one or more small pouches in the digestive tract. Diverticulitis is more common after age 40. More than 200,000 U.S. cases per year. Requires a medical diagnosis. Lab tests or imaging often required. Treatable by a medical professional. Short term, resolves within days to weeks.
It's bad. She gets it a lot, but she takes Cipro for it, and she doesn't have any bad side effects. She's never had a seizure from it. So there is, people out there that can take Cipro without having any bad side effects. I'm just going to read what the Epilepsy Foundation has to say, and I will also put the link yet again in this video, just to let you guys know that I'm not talking out of my ass. As you can see, this is a new background for me. I've got my diffuser over there with peppermint essential oils coming out, so because that's kind of calming for me, and I also had peppermint in my coffee again this morning, which I don't mind it. It tastes fine, but every time I go to take a sip, I sneeze because it's just the strong aroma of peppermint, which is fine. It helps me when I'm done drinking my coffee. It says the winter months are a time when sore throats, runny noses, bronchitis, and the flu are common illnesses. They may require you to take either over-the-counter medication or medication prescribed by your medical doctor. You may wonder if your seizures or your seizure medication will be affected by taking another medication. The best approach is to ask your neurologist or nurse before starting any new medication, but there are some guidelines to follow to avoid any problems with interactions between your seizure medications and treatments for colds and flu. So that's basically your chest and up. If you have like an upper respiratory infection, or like I said, like sore throats, runny nose, bronchitis, all of that jazz, there are antibiotics out there that you can take, and I will link them in the description below. I don't want to make anybody mad with what I'm about to say. Let me start from the beginning. My dad, he has had cancer 2 or 3 times. This was when I was in the 5th grade, so oh my goodness. 6, 9, 10. So he had, what they first did, they took his tonsils out first, because that's where it started. I want to say, it's been a while, I should have asked my mom this. And then he went in for a second surgery because the cancer spread into his lymph nodes. So what they did was they cut from like behind his ear down like that, and just took out all of the cancer in his lymph nodes. So he had to learn how to swallow again, he had to learn how to sneeze again. It was really bad. So after that, my mom always made sure that all of us kids would get our flu shots. And that's what I don't want to upset anybody with. I just want to let you guys know that getting the flu shot in my family was a very serious thing. I've gotten it every year since. This year I actually haven't because I'm the biggest procrastinator ever. Every time I go to see my primary doctor, he offers it, and I'm usually sick, so I have to wait 2 weeks, and then I'm fine, but then I go see him again and I forget to ask for it. I do think that the flu shot does help in a way. I know it's like last year's flu shot, or like last year's flu that they're putting in your system to help prevent the next one to happen. Sometimes it helps, sometimes it doesn't for me, but I get it every year from my dad. This year I've been slacking. So the cool thing with the Epilepsy Foundation website is you can actually type in your experiences and kind of get answers from them. There's a couple people on here who have said that taking over-the-counter cough medicine has actually caused seizures and migraines. That's also another thing to take into account. When you're sick and you have epilepsy, it's very, very important to read up on the side effects and what could possibly happen. You know, you take these antibiotics or over-the-counter medications if you have epilepsy. Okay, so since I can't find anything on the web for the stomach bug, I am just going to let you guys know what has helped me. As far back as I can remember, every time I would get the stomach bug, I would end up throwing up. That would always cause a seizure, every time. I feel like as I've gotten older though, it's become less like that in a way, I guess. I don't really get the stomach bug as much as I used to, but when I do, I make sure I take a promethazine, which is for nausea. Over here, you guys can see my diffuser. I know it's new, that I kind of just got it like a few weeks ago, but I put peppermint essential oils in there, and I also will get like a glass of water and put 2 drops of doTERRA peppermint oil in my water and drink it. It's basically just like drinking water that had a candy cane sitting in it for a while. It's not that bad at all. Drinking Sprite, 7-Up. I know like ginger ale helps my mom. Honestly, I hate ginger ale, so I don't ever drink that. Plenty of rest, staying hydrated, not doing what I'm doing right now. Sitting up and drinking a Dr. Pepper. That's not good at all. But that's all I have for you guys today. I hope you enjoyed this video. I hope you found it helpful. I will definitely link all of the information that I found throughout this video in the description. If you guys have any questions, let me know. But you can always go to Epilepsy Foundation. They have literally everything you will ever need on that site. I'm gonna go to bed. I'm definitely gonna go rest up, try to get this thing to go away so that way I can go to work tomorrow. But I hope you guys have a great day, and I will see you guys next time.